To ice or not to ice? Yes, this is the latest research which I came across on Physio Network. Let's discuss about that. So, whether to ice or not ice during acute injuries or sports injuries has always been a topic of debate of how to manage acute injuries because of the evolving researches, latest evidence based researches for various protocols of management. So now, way back in 1978, we came with the protocol of RICE, rest, ice compression, and elevation, which was considered as gold standard for treating any acute injury. 20 years back, we changed it to price. We added a component of protection. Rest remained the same: rest, ice compression, and elevation. Some 14 years back, it was modified into pulleys when we were doing protection with some optimum loading of the muscle during the rehabilitation phase, so that the recovery can occur faster and the patient or the athlete can go back to his sport as soon as possible. Now, in 2019, this research evoked into something called peace and love. So, in this, P again is for protection, and then E is for elevation, and A is avoiding any thing which will disrupt the anti-inflammatory effect which is happening at the injury site. It could be anti-inflammatory medications, it could be the application of ice. Yes, you heard it right, application of ice. And then again we have communication education to the patient or the athlete. And in love we have optimal loading, and we have optimization of that loading. Then we have vascularization and return to the exercise as soon as not possible, but as soon as it is practical for the person to return back to the activity. Now, why it is happening it is believed that whenever we get injury, what we do if we get an ankle sprain or we get any injury, we run to grab an ice pack and we put on the area. We definitely feel better because ice has analgesic effect, and also it helps in reducing the swelling of that particular area. So we feel good after application of ice. But it has been found in researches that if we apply the ice to the injury site, now what mechanism is happening inside is, whenever there is an injury, it initiates the inflammatory response onto that particular area. So there are a lot of macrophages which releases the hormone IGF-1, which will help in eating or clearing up the damaged tissue, debris from that area, and healing, accelerating the healing. Now, when we apply ice, it distracts with this release of IGF-1, which delays the inflammatory response in the mid and long term management of that injury. So, it's been recommended that not to ice for normal muscular injuries, because when you get any muscular injury, there is not too much of edema in that area, and the topical application of the ice do not reach down to the level of the muscle to give that effect of good effects of ice, in which it will reduce the swelling. But there's a little caveat in this. So I personally will prefer icing, if I found a patient maybe who is recovering from an ACL injury, because the quadriceps is compromised, there is too much of swelling in that particular area, the tissues are compromised, the blood flow is compromised, and there is a possibility of the swelling to expand in that area and resulting in more damage. So at that particular time, I think that icing will help me out in that condition. Also, in chronic joint effusion cases where the major concern is to reduce the swelling, which should not damage the tissue further. But in terms of normal muscular injuries, I don't think icing has any additional benefit apart from a feel good factor of the analgesia and working on the swelling. The ideal is to, make the muscle load, optimal, do the optimal loading so that you return back to your normal lifestyle. So this is the research which they stated, and I would like to know your views about the same. So you can read this research on the Physio Network site, and comment below and let me know what do you feel about the latest research. Now, will you put your eyes back into the freezer, or you will be working with it again in the clinics? So I think it's therapist to therapist preference. Some would prefer, and according to the evaluation done on the patients or the athletes, whether you want to ice or you don't want to ice, you can weigh down the benefits and work as per what you feel is best for your patient. Thank you.